4.3 million Californians, or about 11% of the state's population, receive some type of food assistance from the government. A good portion of those receiving food stamps, 44%, are the working poor, folks who have a job but don't earn enough to escape poverty. Seniors and children make up another significant portion of food stamp recipients. Last year, food stamp assistance was the difference for 780,000 Californians between living above or below the poverty line. Only tax credits had a bigger impact in moving Californians out of poverty. Is everyone who is entitled to food stamps participating in the program? How big an issue is fraud? And are there better ways to alleviate poverty? We'll ask Ryan Woolsey, a fiscal and policy expert on California's food stamp program with the nonpartisan Legislative Analyst Office, and Todd Bland, Deputy Director of the California Department of Social Services and the person in charge of CalFresh, California's food stamp program. CalFresh, is California's food stamp program too much, too little, or just right?
Additional funding for the Maddy Report made possible by a grant from Paramount Agricultural Companies, growing healthy food for you and your family.
From the California Channel at the state capitol, Valley PBS, and the Maddy Institute, it's the Maddy Report with Executive Director of the Maddy Institute, Mark Kepler.
Welcome from the state capitol. Food stamps, or CalFresh as it's known in California, is often the topic of heated political conversation, usually punctuated by anecdotes more than facts. Fortunately, we're joined today by an expert in California's food stamp program to explain just how it works. He is Ryan Woolsey, the fiscal and policy expert for the nonpartisan Legislative Analyst Office, and his focus is on California's food stamp program. So welcome to the Maddy Report, Ryan.
Thank you.
So first, can you explain CalFresh, that's California's food stamp program, who does it serve, and how much money does an individual or family get?
Sure. Well, CalFresh is the federal supplemental nutrition assistance program in California, and as you mentioned, it used to be
SNAP.
Right, SNAP.
All these acronyms.
That's right. It used to be the food stamp program, but they changed the name a few years ago. The program's purpose is to provide nutrition assistance, so food benefits to low-income families to help them get an adequate and hopefully nutritious diet. The amount of benefit that people receive is determined by formula. So if you have a larger household, you get more benefits, or if you have more income, you receive fewer benefits.
Okay. Who's ineligible for the food stamp program?
Well, in California and across the country, most people that are ineligible, the reason is that they have too much income. But there are a couple of other groups that are specifically ineligible by law. These include groups like most full-time college students, undocumented immigrants, and people with certain drug-related felonies. But additionally, California is the only state in the nation where individuals who receive assistance in the SSI-SSP program, this is a program that provides cash assistance to the aged, blind, and disabled. They're ineligible because of a decision that the state made a few decades ago to cash out the food benefits in the form of a higher SSI.
Yeah, so there are sort of, obviously there are some people then that are excluded, but now they don't even, food stamps really is an inaccurate term. They now give these things called EBT cards. How does that work?
Well, you're right. We've been using EBT cards, or electronic benefit transfer cards, since the early 2000s. And the way this works is every month the family has this little card, and the amount of their benefit is put on the card, and they can use it at a grocery checkout line just like a debit card. There are a few differences. Mainly the card can't be used to purchase anything except for the allowable food items in the SNAP program.
If you start talking about this as California's EBT program, no one would know what you're talking about, so we have to use the shorthand of food stamps. So who funds the food stamp or EBT program?
Sure. Well, the food benefits are fully funded by the federal government. And just to give you a sense of scale, in the most recent fiscal year we just ended, it was about $7.5 billion in benefits that came to the state of California. The state doesn't have any part in that, and neither do the counties. However, on the admin side, the federal government only covers about half of the costs. So this is a small amount of spending for the state and the counties relative to the size of the benefits, but it's not insignificant. In the most recent fiscal year, it was estimated to be around $800 million.
But most of that is covered, that's not covered by the feds for administration, is covered by the state, correct?
Yeah, about 70% of the non-federal cost is covered by the state, with the rest coming from the counties.
Okay. There's been a recent spike in the number of Californians eligible for food stamps, or CalFresh, as a result of the recession. Are those eligible actually participating in the CalFresh program, all of those people that are eligible?
No, they're not. And it's kind of an interesting situation. Because of the recession, a lot of people became unemployed and incomes fell. And income is the most important eligibility criteria for the program, so naturally more people became eligible. And this put us in a kind of interesting situation where even though the caseload grew dramatically, in fact it more than doubled in the last 5 or 6 years, the United States Department of Agriculture estimates that only 57% of those that are eligible actually participate. So we've got a whole bunch of people coming into the program, but there's a whole bunch more beyond that who are eligible, but for whatever reason don't participate.
So we've got, in California, we have 57%, you said, participation rate. How does that compare to other states?
So it's important to note that that number is from 2011. That's the most recent number we have, but it's a little bit old now. But in that same year, the national participation rate was 79%. And California actually tied with Wyoming for the lowest participation rate of all the states. An interesting thing to note is within California, some data sources show that participation is not uniform. And interestingly enough, in the Central Valley, participation rates tend to be, not always, but tend to be a little bit higher than the rest of the state. And the reasons for that aren't clear.
I was doing some research and I found that some of the people that aren't participating are working households. They only have a 44% participation rate. Seniors, immigrants, and the homeless. So those might be some of the categories. Is there anything being done to increase those participation rates?
Absolutely. There's actually been a lot of activity in the last few years to try and increase participation rates in the program. The legislature's taken a real serious interest in it, and a lot of changes have been made independently by the Department of Social Services. And I can go into several of those if you'd like.
We'll get into those in the next segment. Up next, what is California doing to make this program work better? That conversation in a moment. This is the Maddy Report. Welcome back. We're talking with Ryan Woolsey, a fiscal and policy expert with California's Legislative Analyst Office and an expert on the food stamp program here in California. So why is California's food stamp participation rate lower than other states?
That's a great question. And first I'd like to note that in general, people of course have a choice whether they want to participate or not, and you're always going to have some people who are eligible but for whatever reason choose not to participate. But that's going to be true in most states, you would think. So the question is, why are we lower than other states? And the truth is we don't know exactly. It has a lot to do with those populations you mentioned that are likely underrepresented. So I'll list a couple of the main reasons that we think it could be lower. First is there could be some eligibility requirements and processes that are maybe unnecessarily burdensome. So for example, in the not too distant past, someone that wanted to apply for CalFresh had to come into a county human services office for an in-person interview. And they also had to have their fingerprint images taken. Now, for certain populations, you can see why this would maybe depress participation, like working households, where it might be tough to take time off work to come into the county office for an interview. Are
working poor the big part of CalFresh?
They're becoming more and more. CalFresh used to be really closely linked with the AFDC program, the cash welfare program, but when we did welfare reform in 1996, TANF caseloads, which replaced AFDC, really went down, and CalFresh caseloads have gone up, and so now the working poor are becoming a larger portion of the caseload.
Okay, I'm sorry for interrupting you. So any other reasons for a lack of
The other main reason that people talk about is that there maybe is a lack of information about the program or maybe some misperceptions. So a big issue in California where we have large immigrant populations is that you might have a mixed immigration status household that's hesitant to apply for benefits for people in the household that are eligible because they have concerns about immigration enforcement. Those would be largely unfounded concerns, but that remains an issue.
Yeah. So what policy changes, you talked about, I guess they're no longer doing fingerprinting, but what other policy changes have been enacted to increase participation?
Right. Well, I'll just go through a couple of the main ones. There's really been quite a few changes that have been made. In 2010, we changed the name of the program from food stamps to CalFresh. That was to emphasize the program's focus on nutrition and clarify what its purpose is. In 2011, the legislature did away with a limit on the amount of assets that people could have and still qualify, which simplified the process. In 2011 also we had online applications put into place across the state, which really makes it easier for some people, particularly working households. In 2012 we eliminated the fingerprint image requirement. Also in 2012 we allowed for phone interviews instead of the in-person interview. And in 2013 we made a really significant change which has more to do with people already on the program. We reduced the number of reports that they have to file every year from 4 to 2, which reduces cases where people get on but then get off for a technical reason like failing to turn in a form correctly.
Is there any concern that these changes could increase fraud, making it easier for people if you just have to do a phone interview or apply online as opposed to showing up at an office? Has any concern been expressed that that might actually increase fraud?
You know, as these changes have been debated and discussed in the legislature, those concerns have been raised. And I think that in general, when you're talking about trying to provide adequate access for a program like this, there's always going to be, to some extent, a trade-off between program integrity and that access. But I think in large measure, many of these changes have been found to not necessarily significantly increase fraud. And nationally, the SNAP program has a fairly low rate of fraudulent use of benefits.
So we've got this 57% participation rate, lowest in the nation. Is anything percolating through the legislature, any bills being proposed to maybe increase participation? Or anything happening at DSS to increase participation that you know of?
Sure. There are some ongoing efforts. In terms of things that the administration is doing, it's mostly about targeted outreach, so reaching out to communities where these populations that we think aren't participating are located. We're also doing a lot with trying to think about cross-program effects where someone might be in a different state program, specifically Medi-Cal, and we know they're probably eligible for CalFresh, so we can pinpoint them and give them the information they need.
So with the expansion of Medi-Cal through the Affordable Care Act, you're now using that as an opportunity to reach these same people who might also be eligible for CalFresh.
Absolutely. Everybody who applies for health coverage through Covered California through the Affordable Care Act is asked whether they're interested in learning about or applying for CalFresh.
Now we've also got Congress passing in February a new farm bill. A lot of folks don't realize that the farm bill is a big portion of that is the food stamp program. So what changes did they make in that farm bill that relates to food stamps that impact California generally and maybe the San Joaquin Valley in particular?
Well, I think the changes that are made in the farm bill, there were some that were made to SNAP, are probably going to affect the state mostly about the same. So I don't know if there's going to be anything specific about the San Joaquin Valley. But most of the changes in the farm bill were relatively minor, and a lot of people might not notice them right away. Things like a pilot to make it easier to swipe EBT cards at a farmer's market, for example. There is one change, though, that has the potential to affect California, and it has to do with something that we call heat and eat. And I'll explain a little bit what that is. Former federal law before the Farm Bill allowed states, including California, to provide a very small utility assistance benefit to everybody in the caseload. And doing this allowed us to further simplify the application and also increase the benefit for a few 100,000 people in the state. Well, Congress in the Farm Bill made a change that increased the amount of utility assistance that we had to provide to get that effect. And California has not yet decided whether it's going to continue with its Heat and Eat program or not. If it chooses not to, there's going to be some folks that will have decreased benefits.
Okay, well, I want to thank Ryan Woolsey from the Nonpartisan Legislative Analyst Office for being with us. Up next, the person in charge of California's food stamp program. That conversation in a moment. This is the Maddy Report. Welcome back. The mission of the California Department of Social Services, or DSS, is to, quote, serve, aid, and protect needy and vulnerable children and adults in ways that strengthen and preserve families, encourage personal responsibility, and foster independence. Todd Bland has a pretty important job there. He's the Deputy Director of the Welfare to Work program at DSS. Welcome to the Maddy Report, Todd.
Nice to be here.
Well, we've been talking about California's relatively low participation rate in CalFresh, which is the food stamp program. What is being done to increase the participation rate for Californians who are eligible but not receiving those benefits?
We're doing a lot of things to increase participation. Increasing participation is a key goal of the Brown administration. I kind of break this into sort of two areas of how we're improving participation. One is policy. Legislature made some important changes over the last few years. And when you look at those numbers showing our low participation rate, a lot of that is before. Those numbers are only through 11. In 2012, pursuant to new law, we eliminated the fingerprinting requirement for recipients. We also changed the law, although this didn't go into effect until 13, for how frequently clients have to fill out paperwork to stay on aid. California used to require that be done every quarter. Now it's every 6 months. Makes it easier for people to stay on, makes it simpler. We joined, when we switched to every 6 months, we joined all other 49 states. We were the only state that was doing it every 3 months.
You know, I was asking Ryan Woolsey from the LAO's office about the concern maybe some might have that by, for example, we're taking away the fingerprinting requirement might result in increased fraud. Is there any concern on your part that making it easier to to participate in these programs so eligible people can get the benefits might also lead perhaps to more fraud?
We're not concerned about eliminating fingerprinting with the CalFresh program. Virtually every other state has eliminated that requirement as well. And we do several other anti-fraud programs. Various matches are done, what they're called EVEs, essentially, where we query different databases to make sure that income that is reported to us is accurate, that clients don't have certain assets. We have various matches that we do, and we do those both upfront when at application, and they're done during their time on aid.
So you're constantly checking?
We're constantly checking, yes.
Okay.
And there's an entire quality control system for the accuracy of how the benefits were determined. And we have approximately a 97% accuracy rate, which is in line with the nation.
Oh, that's great. Okay, well, what about the Central Valley? I mean, we have lower income levels in a lot of parts of the valley, and now we've got the drought that's really impacting a lot of ag workers. What's being done to make sure that CalFresh benefits are being provided to eligible families in the valley?
Well, the valley, as you say, it often has higher unemployment just traditionally, and usually there is greater utilization of various benefits, including CalFresh. I would say on outreach, we have a lot of things going on. Perhaps the most important outreach is things we're doing to encourage the counties to really look at their caseloads, what's going on at the county level. We circulated to county directors, basically, we asked them to give us a plan for how they're going to increase, and each of them took that very seriously. Some are doing things like waiving face-to-face interviews at one end or the other of the program, outreach to seniors, various different things that counties are doing. And I think the other thing that we've done very recently is we've created what's called a data dashboard. And this allows basically each county to compare itself to the state and to the other counties and how it's doing amongst different populations, seniors, non-English speaking groups, whatever it might be. They can compare themselves, and when you have data and you measure, that's when you get improvement.
Right, it's interesting. I think a lot of people probably don't understand that working households, people that are actually working full-time but are still eligible for food stamps, there's only a 44% participation rate in California, at least under the old data. So there's a lot of folks that are deserving of this that aren't receiving any benefits. So you're concerned obviously about the participation rate. Why is that to you? Why is that so important?
I think increasing participation is important for a couple reasons. One is, families need the nutrition and the food support that it gives. That's the most important reason, is if they're eligible for the benefits, they should be able to get them. Everyone who's eligible should be able to access them, easily, and then we should be able to verify that they're eligible, and they should be able to get the benefit. But even more than that, when you think more broadly, that's federal funds. This is the CalFresh and the food stamp program is federally funded. That brings in dollars to California. The United States Department of Agriculture believes there's a multiplier effect of close to 2, 1.7, 1.9. There's different kinds of folks have looked at that, but you get the multiplier effect of bringing those dollars, federal dollars, into the community. So I think it's twofold.
Otherwise, it just stays with the feds. It doesn't come to California.
It doesn't come here, right?
Okay. Well, up next, how big a problem is poverty in the Golden State, and what impact do the state's safety net programs have on alleviating poverty? That conversation in a moment. This is the Maddy Report. Welcome back. We're talking with Todd Bland, the Deputy Director of California's Department of Social Services. So how big a problem is poverty in California, and is it geographically and demographically concentrated?
Now, poverty is a big problem in California. I think it's been highlighted more recently by the work on the supplemental poverty measure, which really takes into account cost of living, and California has a very high cost of living. And so essentially national poverty rates, when you actually make those adjustments, you see the numbers really move up.
And I think
poverty.
I'm sorry interrupting, but I think I saw that the official poverty rate is 16% in California, but with this new measure that the U.S. Bureau of Census is using, it's close to like 22, 23%.
That's right.
And then there's a new measure by Public Policy Institute of California it's around the same number, so quite a bit more.
That's absolutely correct. Most of that is the improved measure is mostly looking at housing costs and different costs of living, but it also looks at the benefit package as well.
Right.
So it's really a better way of looking at poverty. So it's a big problem. It isn't uniform. Indeed, the Central Valley is an area where poverty is higher. Traditionally has been higher and remains that way.
So what impact does programs like the food stamp program, CalFresh, or the welfare program, CalWorks, and other state safety net programs have on alleviating poverty?
Well, under the old measure, they had almost no impact because the old measure
They didn't measure
they didn't really count it. Under the new measure, in fact, they do look at things like the CalFresh benefit, and I believe there's different studies, but I've heard it knocked perhaps nationally as much as 4 percentage points off. I saw another study that said perhaps 8%. So CalFresh does alleviate. It helps alleviate poverty by providing that basic food budget that then the family can use other dollars that they may be earning or receiving in cash assistance to meet other needs.
We were talking earlier about this, the PPIC new measure they're calling the California Poverty Measure, which is accounting for regional variation. Because prices are different in Los Angeles and in San Francisco than they are in, say, Fresno. And they found a much higher, like I said, poverty rate. If they use their numbers, they're talking about 8.1 million people in California versus 6 million under the official poverty rate.
That's right.
So what does this tell us about the importance of federal, state, and local safety net programs?
Well, safety net programs, are critical. I mean, especially when a family completely loses that job, has no other means of support. That's what the safety net's there for. Unemployment insurance, potentially cash assistance under CalWorks or CalFresh, food assistance. For the elderly, blind, disabled, there's SSI, SSP. There are other programs, but they help alleviate that incredibly deep poverty when you have nothing, when you have no job. But they also help families who are working but just aren't earning enough. Okay. And the recession causes two things. It causes people to lose their jobs completely, but also causes underemployment, reduced hours, or reduced opportunity working at lower wages. So I think the safety net is designed to help people as they move up.
I think I read a statistic somewhere that these programs take about 30% of Californians, out of poverty. These safety net programs, so a pretty big impact overall in the state. What impact do you think CalFresh specifically, though, has? Do you have any numbers on how that takes people out of poverty?
Like I said, I want to say the national number it's about, I thought it reduces the poverty rate by about 4%. I don't know exactly how many it moves out of poverty in California. We have over 4 million recipients. It would depend on what their other income was, whether it took them out of poverty, but in many cases it's going to alleviate what we call deep poverty, and that's when you're below half of the federal threshold.
That is severe poverty, and I think actually, now that I remember, I think the PPIC did have 4% as a number that CalFresh impacted. Well, what about this idea that reduced reliance on government programs and more reliance on private charity really is the way to go here? That we can rely really on charity as opposed to government programs to take people out of poverty?
I think they need to work together. Charity can deliver a lot of good services, but when you're talking about a national recession, and a very deep recession in California, they call it the Great Recession, the second biggest downturn in the last 100 years. I'm not sure private charity is equipped alone to deal with that. That's why it's important that you have government programs that are set up, they're in place. CalFresh is a program where if you're eligible, you get the benefit. Unemployment works in a similar way. Those safety net benefits that they're there from the government are important to help people survive that recession. Private charity has its place alongside.
Yeah, there's an argument actually that the charity is pro-cyclical. In other words, when the recession or depression is occurring, people are going to give less just when the need is greater.
That's right. Yeah, exactly. The government is prepared to be able to step in when the economy is weaker, and private charity, the donations may not be as great.
We've only got about 30 seconds left, so I hate to hit you with a big question, but here it is. Critics argue that these safety net programs actually provide a disincentive to work, and that the best way out of poverty is a job. What is your response?
Well, the best way is a job, but because we want people to be able to transition off of these. But families are going to need these benefits, and over 40% of the CalFresh benefits are already working. It's not enough of a benefit for people to subsist long-term on. It's meant to be help when you're completely destitute, and then the benefits decline a bit as you gain income. It's meant to help them make that transition.
I'd like to get
off.
the number, though, for a family of 3 or 4. How much do they get in terms of government benefits?
A family of 3, their CalFresh allotment would be around $500. That would be the maximum allotment if they had 0 income, and then they would get perhaps another $600 in cash from the CalWorks program if they were on them. $1,100, family of 3, roughly.
For a month.
For a month.
Well, I want to thank Todd Bland from the California Department of Social Services and Ryan Woolsey from the California Legislative Analyst Office for joining us. If you want to stay up to date with state and local politics, you can sign up for our free award-winning newsletter, The Maddy Daily, by logging on to our website at maddyinstitute.org. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect those of the Maddy Institute, the California Channel, Casey, or Valley PBS. If you'd like to share your thoughts about the points and opinions shared in the Maddy Report, visit our website at valleypbs.org/Maddy. This is Mark Kepler from the Maddy Report. Thanks for joining us.